Start. Okay. Good evening, everyone. Today we have a class on ECG. ECG is important for everyone. It is a basic investigation, and in MRCP Part 2, some picture questions come where they will give you one picture of someone's ECG with a short history. Or in Part 1, they will give only short history, or they will give some clue like there is a patient with tall peaked T wave with in a CKD. So we know that hyperkalemia causes tall peak T wave. So in that way, so every time there will be three questions, and it is one of the basic investigations. You need to whether you are a physician or an anesthetist or a critical care specialist, you need to know ECG very well, because it is the one of the basic investigations we do for all the patients. Like chest X-ray and ECG are very important for every doctor to learn. So ECG, there are some golden rules from physiology to pathology of the heart, from the electrophysiology and to the clinical diagnosis. There are many, an electrolyte imbalance. There are many things which we can guess from ECG. Now the machine you need to learn. Machine, there is one calibration, something called calibration. Calibration means machine, how the machine is showing the data. So calibration, first it is 10 small square. How does it look? This is the calibration, normal calibration. So ECG paper has small squares and big squares. You can see there are some red big squares and there are some small squares. Every big square, there are 5 small squares. So 5 and 5, 10. So normal amplitude or standardization is 10 millivolt. So y-axis we call it millivolt. So half amplitude 5 millivolt and double amplitude is 20 millivolt. Suppose in some ECG you find very tall waves, and that is not covering up in the ECG paper. So we'll reduce the amplitude and we'll count half of that. We'll take it as half and double it so that we can get the actual value. But normal ECG, the calibration means 1 millivolt is equal to 10 small square. So 10 small square is 1 millivolt. This is the water horizontally one small box. So horizontally x-axis is the time scale. X-axis small squares. One small square is 0.04 second, and big square. So we need to multiply it with 5. So it comes to 0.2 seconds. Vertically, the y-axis is one large box is equal to 0.5 millivolt. That's how it will come as 1 millivolt, or sometimes they call it, there it is 10 millivolt, or 10 1 millivolt is equal to 10 small square. So 5, half of it is 0.5 millivolt. So look for the vertical mark and see that the look at the vertical mark and see that the mark exactly covers 2 big squares, 10 millimeter or 1 millivolt. Standard calibration is 25 millimeter per second and 0.1 millivolt per mm. So in ECG speed, it is 25 millimeter per second. It will move at 25 millimeter per second. If you have seen the ECG machine, there are 2 points, 25 and 50. So normal speed is 25 millimeter per second. So we need to know the machine and the limb leads. RA, we have 4 limb leads. We say RA, RL, LL and LA. So like that, RA means right arm, RL means right leg, LL means left leg, and LA means left arm. And they have special colors also. If it is not written there, in the limb leads it is always written, but if it is not written there, then we have universal color code. The RA is red, RL is black, LL is green, and LA is yellow. And in the chest leads, we need to know the positions of the chest leads positions, we have a beautiful picture also here. Position of the chest leads. So you can see from the left upper part the position of the chest leads. The V1 is located in the right fourth intercostal space just beside the sternum, and V2 is left fourth intercostal space beside the sternum. V3 there is no specific position. V3 we say it is in between, in the middle of V2 and V4, and V4 is left fifth intercostal space in the mid clavicular line. You can see the clavicle, the mid clavicular line, and in case of male, we say just below the left nipple. In case of female, because the position of the nipple varies, we cannot tell that. So it is mid clavicular line, or sometimes they say below the left nipple. And V5 is anterior axillary line, and V6 is mid axillary line in the fifth intercostal space. If we send them to the right side, we say them right-sided leads. So you can have right-sided V2R, V3R, V4R, V5R. Normally, we do not place right-sided leads, but if we suspect right ventricular problem, right ventricular infarct, or right right-sided lead problems, we can have this also. And in case of posterior leads also, if we have to identify posterior wall MI, because if you can remember the anatomy of the heart, we have left heart, right heart, and posterior heart as a posterior wall also. Sometimes posterior wall leads are difficult to get from the anterior leads, so we can place the leads on the back. We say them V6, V8, and V9. So what are the positions? It is written there, and you need to do. I request you to go and do some ECGs by your hands. That then you will understand properly. This we have discussed. Now the all limb leads. Every limb has an axis. Every lead shows some axis. So normal axis of the heart lies in between AVL and this AVF. You can see the normal one lead one means 0 degree, and lead two is positive plus 60 degree, AVF is plus 90 degree, and lead three is 120 degree, and AVR is just totally opposite. If we see the ECGs, we can see that in the case of normal heart, in AVR everything is downwards. Why everything is downwards? Because AVR looks at the heart from the opposite direction only, totally opposite. So everything there will be negative deflection. The P wave will be negative, the QRS will be negative, the T wave will be negative, everything will be negative. So in AVR, because AVR looks the heart from the back side only. So these are the normal ECG axes, and we can identify by looking at the leads from outwards. We can see that V1, if you imagine this is the cross section of the body from the chest wall, and if this is the heart, and if you can see the V1, V2, V1 lies in the fourth intercostal space just to the right of the sternum, V2 fourth intercostal space left of the sternum, and V4 is mid axillary line, and V5 is anterior axillary line, V6 is mid axillary line in the left fifth interval. If we see them, we can jolly well see that V1 and V2 looks at the septal wall, V3 and V4 looks at the anterior wall, and V5, V6 looks at the lateral wall. That's how we need not remember this thing, we need not mug up, but we need to know this, that if there are changes in these walls, V1 to V4, we call it anteroseptal wall changes. Why we call it anteroseptal wall? Because this looks to the anteroseptal wall of the heart. If you see this picture of the heart totally, and V5, V6, if we find changes in the V5, V6, it looks at the lateral wall of the heart. And similarly, if we see the heart, the position of the one and AVL leads, we can see that it is also looks at the lateral part of the heart. So in lateral part changes, in case of lateral wall MI, we will find changes where one AVL as well as V5, V6. In case of anterior wall, we can have V3, V4, V7, V3, V4, and extensive anterior, we say we can have changes to V1 to V6 as well as 1 and AVL, all of them. If we want to see that what is the position of the inferior wall, so inferior wall will be looked from 2, 3 and AVF. You see, these are the 2, 3 AVF are the leads which looks at the heart from the inferior position. So inferior wall problems in the inferior wall changes will be seen in the 2, 3 and AVF. Now what is normal ECG? Normal ECG has these waves, P wave. We know the first positive deflection is the P wave. We have the first negative deflection is called the Q wave, and QR is first positive. Second positive deflection is the R wave, and the second negative deflection is the S wave. And the third positive deflection is T, fourth positive deflection is U wave. And we also have some segments we call QRS segment. QRS segment starts from Q wave to end of the S. So QRS segment or QRS duration, we can have P wave changes. The size of the P wave, you can see from P wave is a P wave from beginning to end of the P wave, they are generally less than 2 small squares. And height is also less than 2 small square. And QRS normal value, you can see from there, we will tell you from the next slide that the normal value will be between 0.8, 0.08 to 1.2 seconds. So 0.12 second, 0.08 to, so 2 small squares or 3 small squares. And there will be some segments, the PR interval, the QT interval, and the QRS, QT segment or ST segment. There are some segments of the ECG which can be looked out, and they will tell you some pathologies. So measure the difference in electrical potential between what that ECG leads to. They measure electrical potential between 2 points. Bipolar leads means 2 different points on the body, and unipolar leads are 1 point of a body and a virtual reference point with 0 electrical potential. So limb leads are bipolar leads and unipolar. Now recording of the ECG, limb leads, as I was telling, you can see it is mentioned from the color code. We say that right arm, RA, will be red, LA, left arm, will be on the left hand, and RF, right foot, will be black, and LF, the left foot, will be green. And the positioning is important because if we do not position them correctly, we will find wrong result. The positioning of leads 1, 2, 3 were first given by Einthoven. It is called Einthoven's triangle. It is a popular quiz question. If you are interested in quizzing, you may find it. The standardized limb leads, this is left arm, left leg, right arm. So these are the positions we say. Now standardized limb leads, the angles, the axes, I told you, one is horizontal, 2 is plus 60 degree, 3 is plus 120 degree, and AVF is plus 90 degree. Clinical interpretation of the ECG. Accurate analysis of the ECG requires thoroughness and care. The patient's age, gender, clinical status should always be taken into account. Many mistakes in the ECG interpretation are errors of omission. ECG, there are some methods that we need to follow that rule, because we have every sex occur because we omit something. We know that, but we fail to see that part only because there are 12 segments, 12 leads, and every lead is important. So there are some rules. We have to know the rules. So this is a ECG I have given here. Can anyone tell me what is the diagnosis here?
Normal ECG.
Excellent. So this is called a normal ECG. So there are many parts we can see, and to find out it is normal, we need to know what things we will look at. We'll look at the rate, we'll look at the rhythm, we'll look at the P waves, we'll look at the PR interval, we'll look at the QRS morphology, we'll look at the T wave changes, we'll see whether there are U waves or not, and we'll see the XT segment or horizontal or any problem is there, any other waves are present or not. So normal ECG, we have to check these following points carefully. So you need to know what are the things you need to see in every ECG. You must see the standardization. I told you calibration. It is a 10 small square 1 millivolt, and technical features like including lead placement and artifacts. Then we need to see the rhythm. Rhythm means sinus rhythm. Normal rhythm of the heart is sinus rhythm. We say sa re ga ma pa. So it is always moving in a pure systemic way. With every beat, the interval of the every beat is same, and we have all the waves that is coming. Every P wave is followed by QRS, and every QRS is followed by T wave, and all the changes, all the segments are more or less same, because you can see here RR interval, because interval between two ECG waves are same. If you see, so this is called sinus rhythm. If the interval between these two are not same, most common arrhythmia in ECG we find is atrial fibrillation. And we say that if the RR interval varies, we will see in atrial fibrillation RR interval varies. So it is not a sinus rhythm. So we called it whether the ECG is in sinus rhythm, normal rhythm of the heart, or no. And we can find out then the rate also. How we find out this is the rhythm called evaluate the rhythm strip from the bottom 12 lead. We say sometimes we take a long lead 2 to find out the rhythm. Whether in the lower part you can jolly well see there are 12 lead ECGs, and at the very bottom we have long lead 2, and there you can see every bit looks same, and there every bit their interval is also the same. Is the rhythm regular or irregular? Is there P wave before every QRS? So every P wave is followed by a QRS complex. Are there any abnormal beats in there? So heart rate, rule of 300 or 1500, regular rhythm, or 10-second rule. So what is the rule of 300? We need to divide the big boxes by 300 and smaller boxes with 1500. So here you can see there how many big boxes are there between two waves. You can find out 1, 2, 3, 4, 5, and 6. So there are 6 big boxes. So we need to divide 300 by 6, and 50 is the rate, 50 beats per minute. So it is normal? No. Normal heart rate is between 60 and 100. If it is less than 60, we call it sinus bradycardia. Why sinus? Because every P wave is followed by QRS, and the difference between two QRS complexes are the same. So you can see this is a sinus rhythm, but heart rate is low. So this is sinus bradycardia. Sinus bradycardia we say less than 60, and tachycardia we say more than 100. This is known to you. So heart rate here also, this is also there. You cannot find out the P waves. Can you find out the P wave? There is no P waves are not. There are P waves, but it is not clearly visible. So, but what we do that it is every P wave is followed by no. Every P wave is not followed by, but the heart rate looks to be the gap between QRS intervals are same. So how many big boxes are there? There are about 4 big boxes. So heart rate will be 75 beats per minute. It is. Can you say what is this ECG? We have not discussed. This is sawtooth
It is
flutter
atrial
waves.
flutter.
So this is atrial flutter. The sawtooth flutter. Sawtooth flutter waves. So heart rate here you can see Then what is the gap between two QRS complexes? These are 2. 1.5. Basically, that is not 2,
এটা ভিটি
1.5. So
হচ্ছে
heart rate will be 200. So this patient is going to die. This is called ventricular tachycardia. If we not intervene at this moment, this is ventricular tachycardia. This is not good. The heart is going to stop very soon. We need to give something patient. Why? What we give? We generally give DC shock.
যদি
Synchronized
হিমোডাইনামিক্যালি
DC
ঠিক
shock.
থাকে
তাহলে আমরা অন্য কিছু দিতে পারি, কিন্তু সব জায়গাতে লিডোকেনও দিতে পারি, বাট মোস্টলি ডিসি শকস আর গিভেন। Now, what is the 10-second rule? Count the number of beats present on ECG during 10 seconds. That is 50 beats big squares. What do you mean by 10 seconds? Multiply them by 6 for irregular rhythm. If the rhythm is totally irregular, so what we'll do? We will count how many are there, how many beats are there in 10 seconds and multiply it with 6, because it is totally irregular. Here what is happening? Here there are, it is sometimes VT and sometimes VF is also there. So you can see the irregular, very irregular rhythms. It's called ventricular fibrillation, and sometimes the positive waves are same. It is VT. So this is ventricular, and if you want to find out what is the rate, so count the number of beats present on this ECG during 10 seconds. 10 seconds, or that is 50 big squares. So how many are there in 50